Hello and welcome to the Public Health Insight podcast. We will be engaging in an interactive discussion of the latest public health issues affecting you and your communities all around the world. My name is Sully, and I am joined by four of my friends.
Ben,
LaShawn,
Gordon,
and Will.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or affiliated with.
In this episode, we'll be picking up right where we left off in our COVID-19 discussion. We'll be sharing tales from the quarantine of everyday people and talking about the successes and failures of COVID-19 testing. So I'll open up the floor. What are your tales, guys?
I started baking cookies.
Oh yeah, those green cookies.
Yeah, bro.
what were they?
Matcha, white chocolate.
Oh, matcha, okay.
Oh.
Yeah.
Matcha and
what
white
happens
chocolate.
what happens when you're stuck in the home, like when they're stuck in the house for weeks.
You sure it wasn't an OCS cookie?
No.
Oh,
Kind of
okay.
run out of things to do, man.
Oh, I see.
Anyone else do anything fun?
I saw the sun for the first time in a while, so that was cool. Yeah.
It was, it's kind of sunny today, so I took Theo for a walk, so he's pretty happy. Hopefully he doesn't make too much noise while we're filming this thing.
Wait, maybe you should introduce Theo to the podcast right now.
Yeah, who is Theo?
No, it's if I introduce him, it's
No, just say who he is.
Oh, Theodore is my son. He has 4 legs, and he's very small, and he's a mix of pug and Shih Tzu.
I think the audience, they want a picture. How can we give it to them?
What we'll do, episode 2.
They gotta follow us on
episode
Instagram.
2 thumbnail. We'll put Theo's picture.
Oh, okay, all right.
That's what we'll do.
I'll make it.
Theo's
No, it's
picture
an
on
Instagram special.
Instagram special for the followers.
Instagram special.
All right,
I don't
y'all.
know, but
Make sure you
there's
tune
image
in.
rights. There's image rights with his mom and stuff. I don't probably have to pay for that and stuff. That's too hectic, you know.
Let's steer clear for that.
Stay clear for that. Yeah.
Just remember social distancing.
Social distancing.
Oh, yeah. About social distancing. No, guys. We actually have to share some stories. Come on.
What are you talking about? We've been sharing, bro.
No. Share some stories.
All right. I got a story. Sorry.
Okay.
All right. So for social distancing, I don't know about y'all, but you can play games on like Discord, which is a web-based. What is it? Well, I don't even know the correct term to describe it.
Is that that Fortnite type thing?
No, definitely not.
It's like
Discord is like a voice chat.
It's like Skype and Steam mixed together.
Yeah, so you can like play games.
That clears
with
it up a
people.
lot for people like me who don't know what that is, Sully.
So it's a Wikipedia/Steam. Viewers can do their own research, but basically you can set up, like, you don't have to be like, social distancing and social isolation don't have to be the same thing. So you can play games online over the internet with your friends. So we've been setting that up. There's also Netflix watching parties that are a thing, but TBH, I just fall asleep through it.
All right, so today the Canada's health minister, Pt.2, she had exercised her powers to enforce some of those self-isolation and social distancing procedures that are not being followed. So what do you guys think about that?
Would you be able to maybe clarify for everyone what those, I guess, actions were that she wanted to enforce?
In some cases, returning travelers from foreign countries, obviously, are now mandated to self-quarantine for a 14-day period, or else there will be some type of penalty, whether it's monetary or criminal penalty, for violating those conditions. And as well, as per normal, if you are diagnosed with COVID-19 you violate your self-isolation orders, you may also get in trouble. So in India, and I can't remember where else, there's another European country, they have also had strict measures like this. So what do you guys think? Good, bad, ugly?
I think at this point, seeing how in Canada there's been numerous cases where people have just blatantly disregarded the recommendations put forth by the Public Health Agency or the Chief public health officer. I feel like at this stage, it's probably for the best, right? It's either we go forth with enforcing the Emergency Act, I believe it's called, or, you can risk not actually flattening the curve and cases popping off.
Well, I think it's kind of like what we were talking about last episode. We were talking about how maybe people weren't taking COVID-19 seriously. But I think when you start enforcing certain rules or like social distancing, people will start to take it seriously, because when there's monetary fines, people tend to maybe follow that more so than if there weren't any sort of fines enforced. But my question is, how would you actually enforce this? Like, how will that actually look?
So I heard that when people come in through the airports, they at the kiosks, they either sign or check off a box saying that they acknowledge the need to go home and quarantine for 14 days. And so I feel like if someone was to avoid that agreement, you can kind of backtrack and be like, okay, this person came back to the country within the last week, and now they're out and about running around, right? Because if their whole city or their whole community is on a lockdown or is advised to be social isolating, and you just see these people still out and about at the parks, playing or having parties, having picnics, then when the law enforcement officers or whoever do approach them and apprehend them, you can kind of connect the dots there. And I'm sure the law enforcement authorities have, I guess, a system in place.
Yeah. Do you think the community plays a role in enforcing this as well, like some sort of community watch?
So that's what I was thinking about earlier, and I think that's kind of problematic, because if we kind of get into that aspect of community accountability, then I think it can really emphasize and foster almost like people snitching and tattling on each other.
Right. Like discrimination too, right?
Exactly.
Right.
For example, if I heard people upstairs or like downstairs or like my neighbors, having a loud noise, I can be like, oh, okay, maybe they're having a party. Maybe they're having people over. I'm going to call whoever and get them in trouble. Right. And I think that just really disrupts the whole neighborhood community vibe. And that's not good either. So it's difficult.
So I'm thinking this community-based thing, I'm thinking about it in a less serious note. So instead of calling authorities on people, it would be just like the community approaching each other and like enforcing it on themselves. In contrast to like having the police over.
Yeah, because that goes into law enforcement services and whether those services are readily available to handle these type of disputes. I mean, I understand where Will's coming from, but I also think, to play devil's advocate, that it's context dependent on the community. For example, if some communities are so tight-knit and everyone knows each other, then the whole keeping everything accountable system is probably going to be more successful.
Yeah, we'll best work with that type of community. I agree.
Yeah, but I also agree that when you bring into the whole snitching and tattling sort of atmosphere and mentality, people are probably going to do whatever they want. They're just going to be more secretive about it, Mm-hmm. Like, I'll have people over. It's just like, hey, guys, keep it down a bit so Will doesn't know that we're here. Kind of that type of actions are going to take place. So it's hard to say.
So what you're saying
at this point?
So what you're saying is it's culture dependent.
It's definitely culture and context dependent.
Mm-hmm.
But I think whatever Gordon said about how mandatory, a better way to say this is how there's actual legit consequences to the lack of social distancing from a government perspective is probably the better idea.
Mm-hmm.
And we just have to kind of see how it evolves, because like Will said, either Will or LaShawn said, is that I don't think people take things seriously until there's a financial aspect to it.
So speaking of finances, the Canadian federal government announced a $107 billion emergency aid package, which will begin kind of going out to all Canadians who have been affected by the pandemic starting sometime in April. Do you guys have any thoughts about that?
You're referring to the employment insurance?
Not necessarily.
No, I think they combine two items: the employment as well as just individuals who are affected, whether they're taking care of family members or if they themselves have been affected by COVID. They kind of just wrapped everything together into one financial aid package instead of having two different ones. But anyways, so that financial package. What do you guys think about it?
Yeah, I think if such thing is implemented, I really think it was stimulate the economy, because like now it's getting very stagnant, and if we're not careful, it's gonna go into like a recession, the likes of which of like 2008. Yeah, so stimulating the economy as in like, okay, you give people money to just buy stuff, and when they do that, like it will move the whole economy forward. I mean, not like to the same extent like it was before, but it will like counteract what's happening right now.
So one of the problems with the economic response package, right, as LaShawn alluded to, there's an EI component, and then there's just a component where if your income is essentially insufficient because you maybe weren't able to work as much because of the lockdowns, you would get, I think, is it families or individuals? I'm not sure, that would get $2,000 a month. But there are certain requirements that make you eligible or ineligible to get those benefits. So I was watching they had the bill in Parliament, I think, today, and they were trying to work out the details of what the bill will look like when it's passed. And one of the things that the finance minister got drilled on was, if for people who are essentially self-employed, who maybe earn like $100 or so, they're going to not be eligible for those benefits. So there's a lot of issues of how the bill is structured and who's eligible and who will benefit and who won't benefit. So I don't know if that is the answer. And from my experience of looking at kind of bailouts and economic stimulus packages, it never ends up really trickling down to those who need it. Like, for example, the 2008 bailout that Obama passed, a lot of banks and CEOs profited from that, and it never really trickled down to the workforce. A lot of people still got laid off. So I think this time it seems that they keep mentioning they're trying to put checks in the hands of Canadians, which is different. So maybe that will have more of an effect, because when you put the buying power in Canadians' hands, you can have trickle up economics, so that will help grow the economy.
That's interesting, Gordon.
I want to bring to your attention, so like what happened in 2008 when Obama like passed this thing. In contrast to that, I think Australia actually gave I think $700 or so to each individual in the country, and like they didn't suffer as much as other countries because of that.
Interesting.
So just to, I guess, move on to a related point. So it's interesting that you brought up Obama and the 2008 situation, because I wanted to talk about what our neighbors to our south, like how they've responded to the situation in terms of economic stimulus packages, right? Because I believe the U.S. Senate passed a bill for $2 trillion.
That's right.
Or at least $2 trillion. And I guess the president of the United States is very adamant on saying that he believes this pandemic and this situation would blow by, and by the time Easter rolls around. What do you boys think about comments like that, and just the other comments that we've been hearing from him?
I'll go last because I have a lot to say.
So I know that President Trump sometime last week was talking about, an anti-malarial drug.
Oh,
okay.
Oh.
Chloroquine, right? And he he was touting it as, a possible treatment or
Miracle drug.
prevention.
Yeah.
Miracle drug, yes.
It may work or it may not work.
Against COVID-19. And, very recently, I believe as yesterday, I heard that, unfortunately, a gentleman in Arizona, him and his wife took some products with chloroquine,
That's right.
and the man died. So I just think that having, the leader of your country just being such a loose cannon and just saying stuff like this, it's a public health hazard, is it not?
Yeah, because the problem is this: you're balancing hope with reality.
Exactly.
Right. So when there's hope without any reality, then their expectations is different than what's actually happening. So chloroquine is an antimalarial drug that has been used for years, and it's been shown to be very safe for those people who use it for the original intended purpose. Okay. So when you have drug repurposing, which is when you're using a drug for a different condition than what it was intended or approved for, then that leads to you have to go through another set of clinical trials, essentially to scale that up to apply it to a different population with a different illness. And in this case, we're talking about COVID-19. So the problem is, and azithromycin, essentially there was a combination of azithromycin and chloroquine, and there's a derivative of chloroquine called hydroxychloroquine. Yeah. So those were used in combination in for some patients in China, somewhat successfully. But I think the sample size was about less than 100 people. So it's not generalizable to the public in China, much less generalizable to a whole different population in the United States. So when you see stuff like that, and then in the same press conference, you have the I keep talking about him, Dr. Anthony Fauci, who's leading the COVID-19 task force for the United States. Very smart guy, a lot of experience. In that same press conference, he has to go up. This guy's face palming in press conferences that he has to sit through with Trump. It's unbelievable, because in the same sentence, he has to go up and say, my responsibility is basically not to check the president for every wrong thing he says. This guy looks so stressed out, man. Like, you watch CNN, this guy, he's already old. The guy's like 79 or something, right? And like in the last 3 weeks, I've seen this guy. Man looks so old. Man looks so stressed out.
This guy's like, I don't want to have none of that. What the hell?
Yo, it's hectic, man. Trump will say one thing, then he'll pop off on reporters because he doesn't like that they're asking him questions that he should be able to answer. And then when he doesn't, if you watch him too, when he doesn't feel like it, or if it's too hot in the room, Trump leaves. He whispers in Pence's ear, and he's like, "I'm out," and then Pence has to take the heat. It's crazy.
So I've been kind of keeping track of the case the situation in China, even though the epicenter has been moving to Europe.
Right.
And I've noticed that an interesting kind of new development is that it's not that China isn't having any new cases. First off, it's their number of cases they are getting each day has drastically decreased. Same with the number of deaths. But also, it seems that the cases in China are mostly linked with international travel.
The new cases.
Rather than community transmission.
Right.
And that's what I find to be very interesting, but also kind of, it just shows how things kind of come full circle.
Right. Like it goes, and then now it's feeding back into the original genesis of the whole thing.
Exactly. Right. It's like, I believe sometime earlier this week, they're reporting cases of people returning to China from the United States,
right,
with COVID, and that was kind of been feeding it back into the population.
But you know why that's a huge problem though, because I think when you do the numbers, right, only 0.1% of China's population got confirmed positives with COVID-19. So you have 99.9% of the population, right, who can get COVID-19. So you can have several more outbreaks if they don't make the right decisions from right here.
Right.
So that's a huge problem.
That's a good point. That's just the capability of China having just another outbreak of a second wave, a third wave, whatever, right?
So, well, just a quick question. So that second wave, is that due to China repatriating Chinese citizens back into China from America?
I wouldn't be able to answer you.
No,
for that one.
not only America, just from Europe too.
Like generally travelers.
Okay, so they are.
Yeah.
So I just brought up America because that was just what I read.
Right.
In the article,
America is one of them for sure.
Yeah.
So I'm wondering about, I guess, the protocol they have at the airports to screen for individuals that may have COVID-19. Like, is there any system in place? Like, I know in Canada, it's kind of like that self-reporting and signing a little waiver.
It's very similar to what we have in Canada.
Okay.
So just a bit of context for our listeners. In Canada, they've limited international flights to the 4 largest airports in Canada, which is the one in Vancouver, Calgary, Toronto, and Montreal. And all international flights must enter the country at one of these 4 locations. And in China, I believe it's a similar system where there are, I want to say, 10 to 12 major airports where international flights can come in and flights can leave. And once travelers arrive at these destinations, it's the full 9 yards of, screening them, questions, asking them about where they've been, and then doing all the temperature testing and everything like that. And once people, I think, even are suspected of having COVID,
Right.
they get moved into a specialized hotel / hospitals kind of setting where they are just kept in rooms and monitored by doctors and health professionals until they pass the 14-day period. Or if the conditions get more and more serious, then things get escalated. But
also their testing capability now, I think it's way superior to what we have. They can get, I believe, results in 4 hours.
Wow.
And our turnaround time is not 4 hours. So they within the person lands, they can theoretically get tested at the airport and have the results before they go to bed.
Sorry, I'm not familiar with that. Is that a different technology that they're using to get that result back quicker? Or
I'm not sure why the turnaround time is shorter, but they can get results in 4 hours. And I think I was watching a TED Talk kind of interview with Bill Gates today, and he was saying that from his inside knowledge, the US they're getting closer to shorter turnaround times, and I imagine Canada would be pretty similar. But I'm not sure why it's so quick there. That's something we could look into.
All right, boys, that was a very interesting discussion. But do you guys have anything else you wanted to add before we kind of end off today? I had one thing I just wanted to kind of remind everyone and just our listeners at home, just everyone out there, that despite all these restrictions on social isolation and social distancing, that we're to be physically distancing ourselves, not socially, separating ourselves from our friends, our families. So even during this time, I just encourage, all you guys, as well as myself and everyone who's listening, to reach out to friends, reach out to family, keep checking on your neighbors, check on those people you care about, and just make an effort to really take some time out of your day to for the human moments of life.
So wholesome. So wholesome.
I love you.
The heart of the group.
Yeah, that's a great point, Will. And also, I just wanted to bring up one point. So we got a lot of comments about the quality of our last episode. People thought that the quality was too good to be recorded online from. So
Oh, yeah.
yeah. So
We're so good.
we just wanted to remind you guys that we are in fact recording these podcasts online and we're not doing it in person. So we just really want to stress to you guys that you all should take social distancing seriously. Yeah.
Yeah, don't wait for the
You
police
don't wanna
to
lose money.
handcuff you
Don't lose
and charge
money.
you $5,000.
Last word.
Also, last word. It's gonna come to a point because in Newfoundland they're taking away driver's license. So if you like to go to the grocery store to pick stuff up and you should be self-isolating because you're a returning traveler, or you've been diagnosed with COVID-19, or you're a close contact of someone who's been diagnosed with COVID-19, you can get your
Don't
driver's
let it
license taken away.
happen.
How do they
And I don't
enforce
think you
that?
want that. So
That's
Never mind. That's it.
And remember, public health is a field of inquiry and an arena for action to improve lives one population at a time. This has been the Public Health Insight Podcast. If you've enjoyed this episode, please drop us a like and follow us on Spotify, Apple Podcast, Google Podcast, or your podcast platform of choice. You can also send us your questions, comments, and suggestions for discussion topics at thepublichealthinsight@gmail.com. Thank you for listening, and we'll see you in the next episode.